Okay, so we'll just give it a few seconds just to have everybody enter the virtual room. That's great. It looks like we have people entering and loading in, which is brilliant. Okay, well, good morning, good afternoon, good evening from wherever you are watching. And thank you so much for joining us today. My name's Nathan from the European Pain Federation, and today we have the privilege of gathering to discuss the On the Move campaign. Now, I'm not going to give too much away because we have some brilliant individuals who are going to be doing just that, explaining what that is in just a moment. I'd like to take this chance just to quickly say, again, thank you so much for being here. And this is, of course, an interactive and recorded webinar. There's going to be lots of information, so we really want you to ask some questions. And you can do this via the Q&A function at the bottom of the screen. You can also do this anonymously if you feel like that suits you a little bit better. There's also a comment section where you can post anything that you might feel is not related to a question, but you feel is important. You can do that in the comments section as well. What we'll do is we'll keep the questions towards the end of the session so that we make sure that all the presenters have a sufficient amount of time to be able to talk about what they want to talk about, which is great stuff. So with that in mind, let's move on. That's enough from me, but please get your questions in. We are looking forward to hearing them. I'm just going to hand over to our moderator, Michiel, if you want to continue for us. It's great to see everybody.
Thank you very much, Nathan, and thanks EFIC for organizing this webinar. Am I allowed to share my screen, Nathan?
Yes, if you could do that, let's give that a go.
Let me see. Of course, that would have been great if I would have prepared that in advance. Share screen. There we go. Here it is. Am I now sharing the program of today?
Yes, we can see all of the slides there.
Oh, that's wonderful. So hopefully, yes, here it is. Well, thank you. I'm Michiel Reneman, Reneman from the Netherlands, professor in rehabilitation medicine up north in the Netherlands in Groningen, and I will be moderating this webinar today. Thank you all for being here. And before we actually start with a great lineup of presenters of this OTM On the Move campaign, I would like to say our thanks to EFIC to organize this and set this all up, to the task force, the On the Move task force, who has been working on several things for years now, and on the authors of the position papers that will be the position paper that will be presented today. The program today is, we will start with Bart Morlian, who is a past president of EFIC and who all started this On the Move campaign. And I will not give it away at all because he is actually the one who began all of this. He will present for 10 minutes how this all began. Then we will move over to Catriona Cunningham from Ireland, who will present a position paper that was recently published in the European Pain Journal. Marja Kinnunen from Finland will present the patient perspectives. Rona Fullen, another past president of EFIC, will present online because she couldn't be here in person, but she has prepared a presentation for us on where we are today and what all you can do to implement the on the move stance. And then, of course, we'll have the Q&A, which Nathan just already mentioned, that you can already send your questions or comments in the chat, and we will have 15 minutes at the end. So without further ado, I would like to hand it over to Bart Morlian, who will also introduce himself a little bit more in depth than I did. Bart, can I hand it over to you?
Thank you very much, Michiel, for this kind introduction. I will try to share my slides. So let's go into presentation mode. And then I want to thank EFIC for inviting me to give this historical overview. Nathan also for moderating and organizing the webinar. And I say hello to all participants, and hopefully you can see my screen now. I want to start with a poll because I want to ask you if you want to have a medicine that does the following, that makes you happy, that a medicine that improves self-esteem, strengthens muscle power, evaporates anxiety and depression, and decreases blood pressure and cholesterol. You can leave it in the chat if you want to have this medicine. Shows your muscles, improves your intellectual capacity, and improves endurance, helps to control your weight and sharpens attention and concentration. And it's available everywhere for free without prescription and safe even to children. So we call it movement. And indeed, if we look in history, Hippocrates from Kos told us already that if we could give every individual the right amount of nourishment and exercise, we could have found the safest way to health. Another quote of him is, "Walking is man's best medicine." Nowadays, I have also lectures on a topic which interests me also a lot, which is food and nutrition in medicine and pain medicine. But I must admit that nourishment and lack of nourishment for most of us is not a problem anymore, but an issue in pain management. But of course, movement is so important. And if we look at the strategies to optimizing treatment choices for chronic pain, you know that we consider pain as a biopsychosocial phenomenon, and that we build mostly on 3 pillars, which are, of course, interlinked. It's a little bit artificial, but as physicians and many healthcare providers, we focus partly on medical technical interventions, which is the part which is mostly expected by our patients. But let's be clear, movement and exercise and the psychosocial pillar are so important. And if we look at these medical technical, we will not discuss today pharmacotherapy or any other means of interventions. We will not dwell too much on train the brain strategies, although these are very closely interlinked to the role of physical activity. But of course, CBT, like ACT, acceptance and commitment therapy, mindfulness training are so important. And this brings me then finally to the role of movement and exercise. It's so, as indicated already, exercise and movement are also important in the train the brain paradigm. And it's well known that physical activity has health benefits, as I discussed in the beginning. We know that it reduces risk of cancer, cardiovascular disease, diabetes, improves mental health, but has also a very important role in primary and secondary prevention of pain, and especially chronic pain. And if we look at the historical part of this On the Move campaign, I want to remember that many years, almost so exactly 20 years ago, EFIC started the campaign Europe Against Pain, and it was kicked off in the European Parliament on the 9th of October 2001. So it's it's an ongoing campaign for many, many years, and this eventually led to actions every single year on part of EFIC, and was picked up also by the International Association of the Study of Pain, and would lead to the first ISP Global Year initiative in 2005 with the Global Year Against Pain in Children. And being president-elect of the European Pain Federation, EFIC, many years ago, it was one of the prerequisites of the president-elects of both ISP and EFIC to have a brainstorm on what will we do during our presidencies on the Global Year Against Pain on the topics. And so that's the reason that Professor Lars Arndt Nielsen and myself had a nice lunch together, and we chatted about what we wanted to do within the next years. And one of the ideas which was promoted, prevention of pain. Actually, I wanted to do something more on physical activity, but we generalized this, and it fitted nicely also within prevention of pain. Not only secondary prevention of pain, but also focusing on primary prevention of pain. And this brought in the idea, okay, but we do campaigning always for 1 year. And during my presidency, I want to kick off something which maybe will endure also a longer time, or at least 3 years during the presidency. So we had made a proposal to the executive board of the European Pain Federation, and it was well taken. There were many questions, but in the end, I got a go to initialize a campaign, which I would not share myself, but the idea that we should do more efforts in promoting physical activity within the pain area. So that means that we had the first presidential campaign starting off in 2017, so 7 years ago, focusing on the importance of physical activity in preventing primary and secondary pain. And it was chaired by Professor Brona Fullen, and she will at the end also indicate what campaigns were started. For some reason, I'm losing my slides now. Probably let me just check what happened. Okay, here are my slides again. And so I was very happy that Brona took the responsibility as a physical therapist to lead a group working on the role of physical activity in pain. And of course, we needed some campaigning. And those people who were already around in EFIC know that I'm quite control freak. And so we had even weeks of discussion on the issue of the logo of the campaign. And as we were chatting before the webinar, we even had discussions on the size of the foot on this campaign, which should be compelling and oppressing you to do something. So every journey needs a first step was the first campaign. And very logically, based on this campaign, also the next president, Brona Fullen, took over something which fitted in very nicely and was complementary towards also the campaign I started. It was on health literacy, because of course, also in the prevention and management of pain, health literacy is so important. And there was a call to action. All healthcare professionals should advise patients on the importance of physical activity and the role that physical activity plays in the prevention of chronic pain. And that means that it requires knowledge, motivation, and empowerment, using language that patients understand. And so it was so nice that Brona chose her campaign also in getting this language to our patients. A physical environment that facilitates change and a plan that helps them to persevere. And those who visited the EFIC Congress in Valencia know that we were really kicking this campaign. So it started that you had to walk a few hundred meters to get into the convention center in Valencia. You noticed that the campaign flagpoles were everywhere. We had the big steps on the floor. And if you were present in Valencia, you know that I really was a pain in the ass by showing all these videos which were created during the pauses and within the pauses of the lectures. And this, I'm very happy, and I'm honored that noticing that this has created a dynamic which is still on the move in 2024. So the initial idea about let's campaign at least for a period longer than 1 year. Let's do something which we can do during a presidency, which takes 3 years within EFIC. I'm so happy that this campaign is still on the move, and you will hear about the accomplishments of this campaign during the next short lectures. And I want to thank hereby all the people who are so active within the working group for still supporting this campaign. Thank you very much indeed.
Thank you, Bart. Thanks. Can you hear me?
Mm-hmm.
Okay, great. Thanks, Bart, for this great kickoff, not just of this webinar, but also of the campaign itself. And one of the major things that this campaign has delivered is a position paper, again, that I already mentioned, that was published just a few weeks ago. And I would like to hand it over to Catriona Cunningham from Ireland, who will introduce herself a little bit further, and she will take us through the position paper. Catriona.
Good morning, everybody, or good afternoon. Still morning here in Dublin, Ireland. So delighted to be here and be part of this movement. And I'm going to speak to you, as we said, about the EFIC physical activity position paper. Now, again, you're all too aware here that pain can act as a barrier to exercise. We know that physical activity is critical for maintaining health and managing disease in the overall population, in those living with chronic disease and in those living with chronic pain. There's clear evidence demonstrating the benefits of physical activity on pain. However, physical activity is challenging for many individuals, and there are additional unique challenges for individuals with chronic pain. That said, many people cite pain as a reason they don't exercise, even if they wouldn't classify themselves as having chronic pain. We know that exacerbations of pain are a major barrier to activity engagement, and this is something we need to discuss with our clients or our patients. And we know that pain and fear of damage leads to fear avoidance beliefs and behaviours. So why am I talking about this? Well, I'm Catriona Cunningham. I'm an associate professor in physiotherapy here in University College Dublin. I've been part of the EFIC on the Move task force. I've also driven the curriculum change here in my own university, but also part of a wider national campaign to get making every contact count, and we'll talk about that a little bit. And I've also been part of a drive to get more pain science into the physiotherapy curricula across Europe as part of the Upscale project. So here's our paper. So you can see all the audience, or all the authors there, should I say, many of whom are in today's webinar online here. And just to say, this group came together very much drawing on the literature, the pain science, the movement and exercise science, behavioral change theories, to come together with patient representatives and generate a position statement on physical activity for pain management. And this was approved and endorsed by the European Pain Forum, the Pain Alliance Group, and the Executive Board of EFIC. And this position paper sets out a number of key recommendations. I hope all of you have read it or will read it for more detail, but I'm just going to talk through the recommendations. Here we have an overview, and this graphic is taken directly from the paper. You can see a series of 5 recommendations here. We also have this available in infographic format, and you'll see a link to that on the online version of this paper. So you may wish to use the infographic to further build capacity in relation to On the Move with your clinicians, with your colleagues. So recommendation 1. Take a physical activity history and put physical activity on the agenda. And this is a recommendation for all healthcare professionals, not just those who have an exercise focus like physical therapists and exercise physiologists. And it's about taking a history, seeing where people are at right now. What level of physical activity are they engaging in? Lots of tools out there. This is simply one that's recommended. The physical activity is a vital sign. Again, a good tool, though, where we're asked to think of physical activity as being the same as taking a blood pressure, as taking someone's weight. On average, how many days per week do you engage in moderate strenuous exercise, and for how many minutes? And that you would total that up by multiplying 1 by 2 and get minutes per week. So putting physical activity on the agenda, and it's really important that healthcare professionals do this. We know it's more effective than coming from members of the general public or people who work in the leisure or sports industries only. Recommendation 2, advise that physical activity is important and safe. And the importance is something we need to get across to our patients. Why is it important? It's important because of the health benefits for everybody in the population. It's also important in primary and secondary prevention of pain. It's safe. We need to help our patients to reconceptualize what pain means, to limit their likelihood of catastrophizing and reduce fear avoidance beliefs and behaviours. Recommendation 3. Deliver a brief physical activity intervention. Support becoming more physically active. Now again, many of you will be familiar with the concept of brief interventions, but this is something you can do by making every contact count. And that's a campaign that the NHS in the UK have moved on. And also here in Ireland, I'm part of the Irish Making Every Contact Count, which has also been embedded across the curricula of all healthcare professional programmes in Ireland. What's a brief intervention? It's in the name, it's short, between 3 and 10 minutes. We use motivational interviewing techniques. It's non-judgmental. It's not questioning where you're at. It's accepting where people are at. It's an assessment of an individual's commitment to change, offering behavioural support, giving self-help material and referral to additional support. And yes, there are a subgroup of people with chronic pain who need more than a behavioural intervention. They will need healthcare professional support, but many will benefit from just getting a brief intervention. And the evidence shows that brief intervention delivered by a healthcare professional is effective in getting people on the right track. Not everybody, but a significant proportion. So this is about getting people to adopt physically active lifestyles. Questions can include in this brief intervention. How important is it for you to become more physically active? And getting people to consider that. Do they consider it important? And exploring the reasons. How confident are you about becoming more physically active and starting to exercise? Again, self-efficacy of exercise confidence, critical. And it's not talking about becoming a marathon runner. It's talking about getting going. How confident are you? Recommendation 4, discussing acceptable levels of physical activity-related soreness and pain. We're working now with people with chronic pain, and we do need to acknowledge and validate fears that patients have. Yes, because you may have a heightened response to exercise, you may initially get a minor increase in pain when you engage in exercise, but pain does not equal damage, and you need to start slowly and build up gradually. If you're in a flare-up phase of pain, you need to respect that. And that's, you need to get that balance of rest and exercise. And for anyone who takes up a new exercise, there is a risk of soreness, and delayed onset muscle soreness is likely to happen for many of us who take up a new activity. But also, if you are particularly deconditioned, there is going to be an associated soreness when you start engaging in physical activity. Again, this does not mean damage, and it's about starting slow and building slowly. So pacing, gradually increasing, and in the initial phases, habit formation, focusing on positive behaviours. It's about building in that 2 minutes of activity into your daily lifestyle. And for some people who are very inactive, focusing on reducing sedentary behaviour may be the most appropriate starting point. So not talking about physical activity or exercise, but maybe reducing the amount of time you sit in the day. And we know this is a positive approach, and that there are health gains in reducing sedentary alone without even focusing on increasing physical activity. Recommendation 5, support staying physically active. And again, this is where you can all delve into behaviour change theory for maintenance. But I think as healthcare professionals, we need to remember we're only part of the picture. And we need to support people and be autonomy supportive, so the patients are coming up with the solutions of where they're fitting physical activity into their daily lives. We need to, from the beginning, consider this person is with me for a short period of time, and where are they going to get their support when they're not with their clinician? But when they do return to you as a clinician, are you going to check in about their physical activity? Are you going to commend them on good behaviour, not good behaviours, but positive, healthy behaviour? Are you going to talk about how much physical activity rather than focusing on pain? And these are key outcomes for people. Are you doing something twice a week, 3 times a week? Are you standing up and moving around more? That's progress. So closing remarks from me. Current evidence supports the use of physical activity as an important intervention. for chronic pain, both for physical and mental health promotion. We believe the position paper is a really important publication and that our key recommendations will help you to engage with colleagues and to push this agenda. We've also highlighted some key resources that you may wish to use. And then, because we know we're part of a bigger society and the socio-ecological model applies to physical activity, we need politicians, media and society and health systems to come together and to promote physical activity, which has very little harm, is a really positive intervention for the vast majority of people, and taking this approach rather than sometimes the over-focus on interventions that may actually be damaging or cause harm. Thank you very much.
Yes, thanks a lot, Catriona. That was very clear and very brief also. For those of you who wish to read the paper, if you haven't done so yet, there is a link in the chat. However, we're not sure if everyone can see that yet, but we're fixing that technically for sure. And if it isn't in the chat now, it will be sent to you afterwards if you want that. Thanks again, Catriona. And very important for many people to know is that this position paper is not only endorsed by EFIC as a professional organization, but it's also endorsed by the Patients Alliance Europe, which is the society that combines the patient representatives of all EFIC chapters. And that's a very important step, that it's not just the professionals, but also the patients who really are pushing towards this. Talking about the patient's voice is included today, of course, nothing about us without us. And I would like to hand it over to Marja Kinnunen from Finland, who will also introduce herself a little further. Marja.
Thank you, Michiel. And it's really nice to continue what Catriona said, because it's really just the same stuff coming on. So greetings from Finland. My name is Marja Kinnunen. I come from Finnish Musculoskeletal Association. My scientific background is in health psychology, and especially in behavioral change and the motivational aspects of health behavior change. So I was really happy when I got this invitation for Pain Alliance Europe to join in, because this is like really important stuff for me, to empower patients and empower people and look at the science behind that. And how do I switch my slides? So I'm going to focus on putting physical activity on agenda, how to deliver a brief physical activity intervention, and how to support physical activity. And I want to start by talking about motivation. Quite often in my work, I meet patients and healthcare professionals. Patients say that I'm not motivated enough, and the healthcare professionals might say that, well, our patients, they are not motivated enough. But from my scientific background, it's quite often not the lack of motivation. More likely, it's lack of self-efficacy, lack of skills, or lack of real or perceived opportunities. Show me a person who doesn't want to be fit. Motivational interviewing has been mentioned already. The handbook has been renewed. The latest edition was published by late 23. And there are really golden citations over there. And this is one of my favorites. Unsolidated advice is the junk mail of life. Another one, fear and shame tend to shut people up. So when you use motivational interviewing, it's not about installing motivation. There is not a magic button in people where you can pour motivation in them, but it's more likely evoking it and being there, supporting people. How can I help you with? How can I help the change? And I think this is the very basics, like why we act as we do. this from self-determination theory by Desi and Ryan. Our basic psychological needs are that we want to make our own decisions. We want to feel competent. We as human beings are kind of creatures that we tend to do what we like, what we are good at, so that we know how to do it. And we want to be part of something, and we want to be valuable for other people. So bearing that in mind, how to put physical activity on agenda? I think really, really good starting point is to listen to your patient, validate their experiences. They might not be something that you feel that are scientifically right, but it's their experiences. And you need to tell them that you've heard them and you understand where they're coming from. And if there is a patient who's been like really couch potato and you feel that this is a sensitive subject, you can, according to motivational interview, you can talk about physical activity without actually asking about it. For example, asking, can you name some factors that make you feel more comfortable with your pain in your everyday life? And if it doesn't come up, then maybe you should ask permission before giving advice. Because if the person doesn't want to talk about it, then you can leave the door open and tell them that I'm here for you next time. So how to start the discussion? What kind of everyday physical activity or exercise have you incorporated into your life in the past or into now? Starting from cutting the grass, walking the dog, gardening, or running a marathon, whatever it is. Is there some form of physical activity or exercise that you really enjoy that makes you happy? Is there something you are good at or something you'd like to try maybe? Recognize your patient's strengths. So active listening, reflect back what they tell you, help people to recognize their talents because they know their everyday life best. And professionals cannot be holding hands every day. So it's really important to promote self-efficacy and help people to find what's important for them and what they are good at. What do they want to do? This came up already. We know from research that healthcare professionals underestimate the fear of movement. So there are validated methods for those. So quite often it's fear of falling, fear of pain, fear of that something gets broken. And remember, patients are the experts of their own daily life. Setting goals becomes in basically every research of behavior change that it's important, but it is not just any goal. It's a goal that is patient-led or shared goal. It should be specific, measurable, attainable, relevant, and time-bound. For example, I do Pilates every morning while my egg is boiling for 7 minutes. As a behavioral scientist, I recommend it to be a behavioral goal. Action plan, coping plan, and implementation intentions also comes from the research to help patients. So when, where, and how will you do these things? And also by showing that these tiny little things add up in the long run. If you squat 10 times a day, that's 300 times a month. Also, what will remind you to do so? Forming habits. What helps you to? What kind of support do you need to succeed? How can I help you with this? How do you monitor? Self-monitoring is also very, very important. And for physical activity, we all have some kind of tools with us all the time. And coping plans. What if it rains? What if you're sick? What if you're absolutely too tired? How do you act in those settings? So emphasizing that elephant is eaten in small pieces. And I want to emphasize also that don't forget patient organizations. They provide support groups. Quite often they also organize some physical activity sessions. They have all kinds of events where you can have peer support and something fun just to be away from home, and sometimes that's really important. They also offer lectures and materials. So how to empower? Help people to find their own reasons and means by emphasizing that tiny bits every day is better than doing something really big for a few weeks and then getting tired and not doing it at all. And when your self-efficacy builds up, then you are more likely to continue. I also want to emphasize that when the routines are set and the environment supports the behavior, the role of motivation is actually not that important. For example, my children run to school every day because we live really near the school. They are obviously not taken there by a car. So it's a routine thing that they always leave a bit late. So that happens every morning. It doesn't need motivation. So if the environment somehow reminds you of doing so, recognize the fear of pain, recognize the fear of movement, validate people's experiences and support their self-efficacy, help them to find their hidden talents, supports people's autonomy, and with patients' own expertise on their unique situation, support them to set goals and form action plans, coping plans, implementations, intentions, and help them to monitor. And I saw Pete Moore's comments on why is this not like behavior change and pain management not supported in educational programs. I couldn't emphasize that more. We have a scientific evidence on how to support people's behavior change, and that should be included. Thank you.
Well, certainly thank you, Maria, for this very valuable addition from a patient perspective. And thanks a lot. And I would like to hand it over with a little bit of nervousness, I must say, to Nathan, because now we have a pre-recorded message from Brona Pullen, also a past president of EFIC. And when we prepared this meeting 15 minutes before the webinar started, the sound quality wasn't really as we wanted it to be, but hopefully it is fixed now. And I'll hand it over to Nathan. Good luck, Nathan.
Thank you. Yeah, no pressure. As Michiel mentioned there, yeah, we've run the so Brona's taken time to record a session for us, which is absolutely fantastic, and we're super excited to hear this. The audio, as tends to be with these types of things, might be a little bit on the quieter side. So the audio will start as soon as the presentation starts. So if after a couple of seconds you can't hear any audio, please try and turn your audio up on onto your computer until you can hear it. It might be that even with the max audio output on your PC or your device might not be sufficient to cover. If it's not sufficient to cover, when we post the recording of this, we're going to try and make some effort so that everybody can hear Brona's voice. You should be able to hear it a little bit, but hopefully it's okay for you. So we do apologize for that, but we do have some content from Brona, which we're going to share now. So it should automatically start in a second. I'm just going to share this content. Fingers crossed. And yeah, we should catch up after the presentation from Brona.
Hello, my name is Brona Pullen. I'm an associate professor in the UCD School of Public Health, Physiotherapy and Sports Science in University College Dublin. I'm also immediate past president of the European Pain Federation, EFIC. I'm sorry I can't be with you in person today. You've already heard from Bart Morleon about the genesis of the On the Move campaign. I would like to summarize the key outputs that hopefully you will access, download, and disseminate to other healthcare professionals, to patients, and to the general public. For Bart's already mentioned that he chose the topic of promoting physical activity as the theme of his presidency of EFIC from 2017 to 2020. At the time, he invited me as president-elect and chartered physiotherapist to chair the committee to work on the scientific and educational content of the international campaign. I'm very grateful to my international colleagues and patient representatives who supported me in this activity. We also collaborated with the Europe region of World Physiotherapy and the Society Impact of Pain. The campaign's goals were to ensure that healthcare professionals advised patients about the significant benefits that came with increasing their activity levels in either the prevention or management. We were also keen to reach out to policymakers so that they could raise awareness among the general public about the importance of being physically active, but also reaching out to those urban planners, ensuring that they would consider the importance of green spaces, be it in parks, in sports facilities, or in schools, to allow the population to develop healthy lifestyle skills. In terms of timelines for the campaign, Bart Morley launched the On the Move campaign in the European Parliament with some MEPs in early 2018. The working group of the On the Move campaign was created, and our first role was to agree on the themes we wanted to prioritise through the campaign. And in order to decide on these prioritised themes, we used a Delphi-style approach where we created an online survey to garner expert opinion from the EFIC community. We translated it into 12 different languages and disseminated it across all of EFIC's social media platforms. When we had agreed on the topics and themes, we developed infographics and short video clips for healthcare professionals, for people living with pain, and for the general public. And we did this in collaboration with the Europe region of World Physiotherapy. Again, to promote dissemination and their use, we've translated all our resources into 13 different languages, and these are free to download on the EFIC website. The topic of physical activity has featured heavily in all EFIC congresses since 2019. We've had 2 to 3 workshops and refresher courses at our congresses in Valencia, in Dublin, and in Budapest. This slide just summarizes the resources we have developed, tips on physical activity for people living with pain, for healthcare professionals in terms of recommending physical activity, and also for the general public in promoting the benefits of being physically active. This is just a close-up view of the infographic for healthcare professionals with some key messages and evidence-based resources for how to support people to become more physically active. Second infographic is for people living with chronic pain. The third infographic are some key messages for the general public about the importance and the benefits of being physically active. As I mentioned previously, all our resources that have been translated into the various languages are available on the EFIC website. The initial On the Move campaign came to an end officially at the end of 2020, but we decided to continue with this important campaign and its key messaging. Henrik Jaeger took over as chair of the On the Move campaign 2.0. And the focus of the On the Move 2.0 campaign was for European healthcare systems to play a more proactive role in encouraging movement and physical activity to prevent, manage, and treat chronic pain. So in terms of timelines, 2.0 has two phases. First phase focuses on our primary audience, and we've developed further resources to raise awareness amongst the scientific and patient community. You heard earlier from Trina Cunningham, who summarised the position paper that has recently been published in the European Journal of Pain from the On the Move Task Force. We've also developed infographics and a short video that will be translated into different languages, again to support the dissemination of the key messages. In phase 2, this is going to focus more on our secondary audience, where we will monitor EU policies to try and influence them by including on-the-move messaging as part of wider health policy trends. We will, of course, reach out and collaborate with other European-level organisations, for example, Europe Region of World Physiotherapy and the European Agency for Safety and Health at Work. This slide just summarises the resources developed from phase 1, as I mentioned earlier, publication in the European Journal of Pain, and then the infographic summarising key messages from this task force publication. Thank you for listening. For further information about the On the Move campaign, or indeed any of EFIC's other activities, please visit our website or follow us across our social media platforms. Thank you very much.
Okay, hopefully that was okay for everybody in terms of audio. If there's anything that you did struggle to listen, again, we're going to be hosting that on our EFIC online platform, so keep an eye out for that one. I'll hand it back over to Michiel. Thank you.
Thanks, Nathan. It did work, not perfectly, but it did work, and I could follow it from my computer. In the meantime, I also had a time to read in the chat. If I have the same things as you guys on my screen, then I have 2 questions already on the chat for the Q&A session. And the first one is from no one else but Pete Moore himself, a well-known patient advocate. And his question is the main reason why supported pain self-management isn't taught in every medical school because there isn't a room within the curriculums? And is there anyone of the panel who will be able, or feels like he or she could respond to that?
I can certainly add something from an EFIC perspective. That is something that comes along to everybody's thoughts. You know, where can we fit this into curriculum? And from an EFIC perspective, some of you might have seen some of the research that we've been doing over the past sort of year or so, where we're looking at trying to map the educational content within undergraduate, postgraduate curricula for medicine, physiotherapy, nurse, and psychology throughout Europe. So absolutely right. Off the initial kind of thoughts would be is do we have space to fit this in? But our research is trying to look to try and identify whether that's actually an issue. And so keep an eye out for some research that we will be releasing sometime soon to help better answer that question. Personally, I agree. I think there's a struggle to try and implement that. However, when you look at the individual components of something like this, where we talked about motivational interviewing and exercise prescription, they tend to be included with most curricula. Maybe not explicitly, but in some form. So perhaps it's not that it's being included specifically. Maybe it's not just labeled as self-management specifically, but I would be fairly confident that the components are there. Whether there's an explicit focus on those individuals to address chronic pain, I'm not too sure, but certainly keep an eye out from an EFIC perspective. We have some hopefully exciting stuff for everybody to have a read towards the end of the year, beginning of next year, talking about the curricular content.
Thanks, Nathan, from this ethics for this ethics perspective. Catriona, I think you have a hand up to respond.
Yeah, I mean, I think working alongside colleagues and working in education, educating physical therapists, I think it's an ethos around behavior change and communication in general that needs to be embedded, and it may be challenging to put it in specifically to pain, but if there was a shift in thinking overall, certainly the Make Every Contact Count campaign was a real effort in Ireland to have a way of embedding it across all healthcare curricula, so that it's about lifestyle approaches. So not just looking at physical activity, but looking at other smoking, nutrition, alcohol, and physical activity, and putting them together in a bundle and talking about embedding physical activity. So it's another way of doing it, but obviously chronic pain needs to be mentioned and specifically as well.
Great, thanks both of you. But just to add, and then I'll go over to the next question. The question from Pete, it's gone now, but it was actually directed towards medical schools and not so much physiotherapy schools. And I think the medical schools may be lagging on this subject, but maybe Bart can respond to that and knows the situation better for the medical curricula versus the physiotherapy curricula.
Yeah, thank you, Michiel. The situation in medical school remains challenging because most of the hours are spent to what I call reparative medicine, and there is really a lack of investing into healthcare, because in my eyes, the word healthcare is not fully accomplished in the training in medical schools. And so, but regarding my own perspective, I notice when it comes to optimizing hours, the few hours pain are cut first. So, and one of the reasons is that in most countries in Europe, pain medicine is not recognized as some specialization in its own right. I know physical medicine, rehabilitation, rheumatology, these are all recognized specialties. And for them, it's easier to build it into a curriculum than getting from a zero starting point, because it's always the discussion about hours and who gets the hours: surgery, internal medicine, cardiology, rehabilitation. And if you're not a recognized specialty, you do not get in. And so for many universities, I see this problem specifically for answering this question of Pete.
Thanks, and I think there's a lot more to say and to discuss about this, and thanks for pitching in, Bart. But we will move on to the next question, and then there is another one, and we would like to stop this webinar at 1:30 sharp, so we have only a few more minutes. The question of Kathy, normally we're told doing exercise as walking or so is not useful if shorter than 20 or 30 minutes. Is there anyone who would like to respond? And I think Catriona is taking it.
Yeah, I'm happy to take that. I think it's all about what outcomes you're looking for. And I think, again, it's about, if you're trying to change behavior, then I'd focus on the adoption of a walking behavior as a positive. Then 15-20 minutes is way better than doing zero. So you can get the exercise dose response. In somebody who's actually sedentary, you make the greatest health gains in moving from that inactive to doing some activity. So it's not correct to say that you don't get a benefit from that amount of exercise, but obviously from optimal health gains, you get them from doing the recommended level of physical activity.
Thanks. I think that's clear, and I hope it is too. For Kathy, now we're moving to the next question, and the name that is really frightening me to try to speak that out. But Hapanovic, what's the best explained nowadays mechanism how really exercises work on the body systems level? Who feels being, and someone who is in the chat now, who is online, who can answer that question? Obviously,
yeah, I can start.
Mira, go ahead.
I think exercise or physical activity works on a lot of systems. Of course, it works on the peripheral systems like joints and muscles and so on. But I think in terms of chronic pain, I think the most important effects of exercise and physical activity are the effects on the nervous system, on the central nervous system, by training the brain by exercise, which can improve pain modulation and temper the possible hyperexcitability of the central nervous system. Besides, it also works on the autonomic nervous system. So by doing exercise, we will stimulate the nervus vagus, which is very important because this will increase the parasympathetic activity in the body, which is important, for example, in sensing and inhibiting inflammation. So there are a lot of systems on which physical activity can have an important effect that are contributing to chronic pain. So yeah, I think numerous systems can be named. Maybe other people can add to that of their experience.
Thank you, Mira. And it closely resembles, I think, the first slide that Bart was showing of that magic pill that can accomplish lots and lots of things. I'm very reluctant to move on to the last question because we have only 1 minute left and I would like to complete. So we will park this question and we will address it later after the webinar, if okay. Sorry about that, Luis Philippe Taverns. But I would like to close at basically now, thanking the EFIC staff to make this webinar happen, and thanks to the 4 presenters, of which 3 are amongst us, for their wonderful contributions, and thanks again to the On the Move task force for their work. And I would like to finish by thank you for being with us this full hour. Almost 60 people were here today. And I would like to hand it over to the EFIC staff to finish this webinar. Thank you.
Yes, thank you, guys. Very, very insightful webinar. And apologies we didn't manage to get through all of the questions. Such is the way that these things go. If it is really a burning question, I'm sure that some of the representatives don't mind a quick email just to try and answer that. Also, you can have a look at the resources that we posted in the chat. There might be an answer in there from all the infographics and the paper and all those useful resources that might be useful as well. So again, as Michiel and everybody put, thank you so much for joining us today. This is a recorded webinar, and of course it's going to be on our online platform, so please take a look at that when you get a chance. But that is everything from us today. Thank you so much for joining us and have a fantastic rest of your day. Take care.